So welcome again as we continue discussing the antihypertensives. Initially we discussed the ACE inhibitors, and today we are going to be looking at the ARBs, or the angiotensin receptor blockers. And if you haven't already subscribed, this will be the time. A Life with Nurse Carol. I'm Mrs. Caroline again. Welcome to my channel, and here we go. The angiotensin receptor blockers, these are medications that target the RAS system of the body and hence inhibiting the effect of the would have been angiotensin 2. So similarly to the angiotensin converting enzyme inhibitors, these drugs also happen to affect the RAS system and prevent the effect of angiotensin 2. So the ARBs work by blocking the target sites of angiotensin 2, especially those found in the vessels. As a result, instead of the vasoconstriction, the vessels will be dilated, hence causing reduced peripheral resistance, reduced afterload, lower blood pressure, reduced workload to the heart. And if you look at this effect, that's exactly what we want to achieve. Because if this person is hypertensive, it means they have an increased peripheral resistance. They have their increased afterload. Their blood pressure is shooting. The heart is working extremely hard. And if we have something that can give us this effect, it means we're on the right track. Again, we are going to be looking at the RAS system to see where our ARBs come in. So the drop in blood pressure or drop in fluid volume will make the kidneys to release renin. Renin is responsible for the conversion of the angiotensinogen produced by the liver to form angiotensin 1. The angiotensin 1, to be converted to angiotensin 2, has to be converted by an enzyme that's released by the lungs, and this enzyme is called the angiotensin converting enzyme. And when this is present, the angiotensin 1 will be converted to angiotensin 2. The angiotensin 2 can have different effects. One, it's a vasoconstrictor, hence causing narrowing of our vessels, leading to a high blood pressure. However, this angiotensin 2 can also act on the adrenal glands to stimulate the release of aldosterone, which is responsible for reabsorption of sodium and water, hence increasing the blood volume, hence blood pressure. So, with the effect of angiotensin 2, where does the ARBs have effect? So the ARBs have effect here in blocking the receptors that are in the vessels to receive or to be bound on by the angiotensin 2. So you find that the whole system will go on, angiotensin 2 will be produced, but when it comes to bind onto the receptors to have its effect, there will be blockage because the angiotensin receptor blockers will be there. Hence, we shall not have the effect of aldosterone being produced, and we shall not have the effect of vasoconstriction. So, if you have a prescription, check. The ARBs have these examples, and my memory lane is Sartan. Sartan is angiotensin receptor blockers. The Sartan is usually the last part of the name of that angiotensin receptor blocker medication. For example, if on your prescription you have what we call the candesartan, irbesartan, olmesartan, losartan, valsartan, telmisartan, Sartan is your catchphrase. The moment you see Sartan, know that you have an ARBs on your prescription. Indications. ARBs are used to prevent, treat, and improve symptoms in conditions such as hypertension, coronary artery disease, heart failure, diabetes, certain chronic kidney diseases, heart attacks, and also in proteinuria. The side effects. These side effects are similar to some of the side effects of the ACE inhibitors, like dizziness, headache, drowsiness, are majorly indications of hypotension. And since our drugs work to reduce the blood pressure, one of the side effects that we expect is hypotension. It's not an adverse effect, but someone needs to monitor their blood pressure so that they don't run into hypotension. And one of the things that we tell patients on antihypertensive medication is that when they are waking up from bed, they need to take some time seated before standing. You don't just wake up and stand straight away. You're at risk of postural hypotension. So wake up, sit on the edge of the bed for some minutes before you stand up. The other side effect is nausea, vomiting, and diarrhea. Hyperkalemia, because we are letting the sodium and the water get out, but since potassium and sodium go in the opposite direction, we are retaining the potassium, so leading to hyperkalemia. Hypotension, bone pain, muscle pain, and rash. So these are expected side effects of ARBs medication. Again, I want to thank you for subscribing. This has been brief, but like I said, discussion of ARBs and ACE inhibitors has some sort of similarities, and it shouldn't worry you. The moment you have an ARBs, it will end with Sartan. So next we'll be discussing our beta blockers. Watch, like, and share. If you haven't hit the subscription button, this would be the time. At Life with Nurse Carol. Stick with me. Thanks for watching.